Welcome back to my show. I'm Michelle Eswine. Beth Wright is the founder and CEO of Translational Education LLC and inventor of the learning system embodied as the Opus Omni ecosystem. Beth is an occupational therapist, an attorney, and a certified fraud examiner. The Opus Omni ecosystem is a cloud-based software as a service solution for education, work, and health management tasks. Opus Omni is a patented system rooted in a broad body of evidence in the life sciences about what factors drive performance achievement in authentic environments. They bake that evidence into a mobile device form factor for your smartphone or tablet that is easy and fun to use whether you are 7 or 107. Ateko, the healthcare vertical of Opus Omni, is part of this digital platform delivered through mobile devices. Ateko will help people with Alzheimer's, diabetes, obesity, heart disease, cancer, autism, PTSD, arthritis, and other chronic conditions to set a clear path forward, make progress towards their goals, and share what works and what doesn't with others facing the same challenges. Today, I talk with the founder, Beth, about her Indiegogo campaign to launch Ateko for Alzheimer's and dementia sufferers and their caregivers. The team's goal is to raise $1.2 million on Indiegogo from everyday people like you whose lives have been touched by Alzheimer's and other chronic diseases, so that the team can speed up building the software of the app and connectivity with supporting information and resources for Alzheimer's dementia management for caregivers. And down the road, this will help the team also apply Ateko to other chronic conditions like diabetes, obesity, heart disease, cancer, autism, PTSD, arthritis, and even fall prevention. Welcome to my show, Beth, and thank you for joining me.
Thank you, Michelle.
What drove you to start this app to help all these people, and especially with Alzheimer's? Why did you choose Alzheimer's?
We chose Alzheimer's because in America, we spend $226 billion a year for Alzheimer's care management. We spend an additional $217 billion a year in unpaid care to caregivers who reduce their work hours and stay home and help manage people who have this disease. That's more money than we spend on heart disease every year in America.
Most people realize that heart disease is the number one killer of most people. So you would almost naturally think that would be the first one that you'd want to focus on. But to your point, those numbers are staggering, what we're spending for Alzheimer's and care for Alzheimer's patients.
Yes, that's true. And we're taking Alzheimer's first, and we'll be heading toward heart disease very soon.
You're able to move from one chronic disease to another.
Yes, with our Indiegogo campaign, what we're hoping to do is raise $1.2 million to build out the core functionality of the app for Alzheimer's dementia management for caregivers, and then we'll be able to take that core functionality and move forward and start to address other chronic diseases like heart disease, obesity, diabetes, PTSD, cancer aftercare, autism, and even fall prevention.
In your background, you have over 24 years of combined experience as a clinical practice, healthcare delivery, healthcare management. You teach healthcare management as well as healthcare fraud. You did a lot of mentoring for MD and PhD students. So you have a lot of background in what this app can help people do. So what you're seeing in your work experience of 24 years is you're finding that people are not necessarily knowing what to do once they're diagnosed with some of these issues, what the family is able to find out about this issue or how they can help their loved one.
Yes, that's right. You know, in healthcare, there's this big black hole. Did you know that in America, 75% of all of the cost of healthcare goes to manage chronic diseases?
75%?
Yes, 75% of all the cost of healthcare goes to manage chronic diseases. But today in America, we have no way to effectively manage chronic diseases where people live their everyday lives. And Ateko is here to fill that hole. You know, hospital systems, physicians, and even insurers have been talking about wellness and prevention for decades. But until now, there's really been no way to effectively manage chronic diseases where people live their everyday lives. And we're here to fill that hole.
Walk me through how this Ateko program would work. If you are a person that gets recently diagnosed with Alzheimer's or dementia, what happens then, or what's the steps that this app would be able to help people with? How would this help their family?
Yes. You know, every week we make it really simple for learners. You know, you find yourself with a new diagnosis, you're leaving the hospital, you're leaving your doctor's office, you're walking out to your car, you're stepping off the curb, and you might as well be stepping off a cliff. And Ateko is there to pick up where healthcare leaves off. You're faced with uncertainty and chaos, you don't know what to do next, and you log on to the app, and we simply help you from day one figure out how to create organization and start planning and setting goals around how to manage your day-to-day life. We help take you through the progression of your goals. We help you share what's working and what isn't, and we connect you into a community of compassionate passionate people who have knowledge and resources and information, and people who are dealing with the same struggles that you are day to day, so that you can help make your life better.
It's not something necessarily that people have to put in a lot of information. They can just be looking at it as a resource, finding other ways or things that work for them, or different times of the day that might be harder for that patient to get through. Can you give me a couple examples with Alzheimer's?
Well, absolutely. You know, when you come home and you have this diagnosis, there's so many things that you need to do, and you don't even know where to start. So you can log on to ateko. The system is so smart that it helps you figure out. You just simply scroll through the interface with your smartphone or your tablet, and it helps you say, oh, wow, yes, I have a loved one, and they're starting to lose weight, and I'm concerned about that. So I can build a goal around that. Or, you know, my loved one has been waking up and wandering around the house at night, and I'm desperately afraid that they're going to unlock the door and find their way out into the cold. So I need to set a goal around that. Or my loved one, well, you know, at 3 o'clock, their whole personality changes. It's if I don't even know them. And that's called sundowning. And so I want to make a goal around how do I start to prevent or ameliorate that behavior. And then we take you through the steps to do that. We teach you the resources and the information that you need to build a goal around that and to create success around that. We create the interface for you to share your progress with your peers and down the road, hopefully with other healthcare professionals, about what's working. And then we put you in a rich community. You know, there's this spectrum of wisdom out there, from the CDC and the NIH to practitioners, social workers, and research scientists who have knowledge and information. And that knowledge and information rarely gets to the person. And if it does, it's in a format that's just, it's not easy to understand, and it's not easy to take and apply and integrate in your day-to-day life. And so what we do is we take that information and we put it in a format that's accessible and digestible, so that people can take it and immediately start using it in their day-to-day lives. And then we drill all the way down across that spectrum of wisdom to the individual caregiver who's in a home, who has a problem with a loved one, and we let them share that experience with the community. And there might be somebody out there who's another caregiver who faced that circumstance a week or 2 weeks ago and has a novel solution, something that science and something that the NIH and the CDC doesn't know works, but that a caregiver has discovered works. And so the collective wisdom really spans this spectrum of individuals who participate and share and make caregiving for people with Alzheimer's better.
A lot of times people are afraid of apps because they feel like they require so much information from you. This app seems like it's very user-friendly in the sense that it's simple to input information if you so choose, or if it's just something that you want to look at the resources of what other people have done.
Absolutely. The small team, one of our primary goals is no friction. It's one of our mantras. And no friction means that we create a way that's so easy and effortless for people to connect with us that it's not hard. You don't feel like you're giving up a bunch of data and information about yourself that you don't want to do to start trying it. As a matter of fact, as we do our build out, we will allow people to go out and start playing with the system and setting their first few goals without signing up as a member, so that they can see it and try it and see if they like it. We're also creating a rich community at ateko.co where people can come and see lots of information and resources without ever signing up and being a subscriber and purchasing our software, so that they can still become a member of a community and share their experiences. They can write to us and post a blog as a caregiver, or they can write to us and post a blog as a social worker or a research scientist about a new study that's available for caregivers, or if they've written a book on the topic. We'd love to hear their wisdom and create a format for them to share it, and also a hot link right to buy their book on Amazon.
Why is this so important, and why does this matter not only for people with Alzheimer's, but lots of the listeners out there right now?
You know, we've got to change the way that healthcare is delivered in America. Everybody knows that we're hitting a crisis point in healthcare, and what healthcare is lacking is a platform to manage chronic diseases where people live their everyday lives. The cost basis of healthcare is becoming unsustainable, and yet in healthcare, we are not moving forward with a way to manage chronic diseases where people live their everyday lives. And I talk with people who want that. You know, on our Indiegogo site, I talk about some of the structural problems that are happening in healthcare today. You know, I've been practicing occupational therapy for 24 years. And did you know that the number one reason in America why people have leg amputations is for poor diabetic foot care?
No, I didn't realize that.
Yes, that's true. And, you know, it's almost embarrassing to say, but across the continuum of care, from acute care to inpatient inpatient acute rehab to skilled nursing facilities to home health, I don't see physicians, nurses, occupational therapists, or physical therapists teaching people good diabetic foot care. But the information is out there. The information is there how to manage diabetes and how to manage foot care better. And we have the power to bring that information, that collective wisdom, directly to people through a mobile device, a smartphone, or a tablet so that they can immediately start doing things to take care of their feet.
Now, how do we move this forward, Beth? Now, how can we help you make this a reality so that people that have Alzheimer's or PTSD or autism or any of that list that I mentioned at the beginning of the show, how can we help you move this forward?
Michelle, we really need the generosity of your listeners. Your listeners have the power to put ateko in the hands of people every day who are struggling with chronic disease. You know, we've talked to private equity and we've talked to the insurers. They're very, very interested in supporting what we have. They want to get out the big checkbook for us. And what they need to see to do that is they need to see a working app and users who love it.
People need to go to your Indiegogo account to help support the campaign at any dollar amount if they are interested.
Yes, every single dollar we raise will help us build this app. It will help us build it faster and help make sure that we get it in the hands of people who need it today.
Where can they go to find this information?
They can go to our ateko.co site, ateko.co, and on our social network site, there will be a hot link bringing them directly to our Indiegogo page, and they will be able to donate and choose a perk if they like. For users who are in the special group who are currently caregivers of people with Alzheimer's dementia, they will actually be able to become part of our alpha team that will be early users of the app and be invited to our annual Learners Conference and help share their experiences with others.
Beth, I really appreciate you taking the time to share this information with us. I think it's a very important campaign and we'll be able to help multiple diseases. I will put your link up on my webpage, keyword Michelle, so if they miss any of this information, they'll know where to find it.
Thank you so much, Michelle.
If you missed any of today's information, you can go to my webpage, keyword Michelle, and I'll have all that information, or go to my Facebook page, Michelle Eswine, to find out more. Thank you very much for joining me, and I look forward to talking with you next week.